Good afternoon. I'm Dan DeRose with 19 News Now, coming to you from our digital desk. We continue to see the eyes of not only the medical world, Washington, D.C., still being concentrated on East Palestine. And of course, the disaster that happened there. We don't need to remind you too much about the train derailment, the Norfolk Southern train derailment that happened there, and the amount of chemicals and gases that were not only let off, but then burnt off from that site. And since that event, since the very minutes after it happened, the questions have turned to the residents of East Palestine. What is this going to do to their future? What is this going to do to their health? Case Western Reserve University and their Case Comprehensive Cancer Center is now getting into the research aspect of this. We're going to welcome in Dr. Frederick Schumacher from Case Western Reserve University. Doctor, thank you for joining us. We appreciate it.
Thank you for having me.
So we're going to have a discussion about what this is. You're calling this the Healthy Futures Research Project. Walk us through, because you're looking for participants. I'm assuming you're asking for that. Let's start on the very basis without getting too deep into the woods. What are you looking for from the East Palestine residents, and how can they help in this research project?
Yes, it's a great question. We're looking for community engagement. This is something that hit their community. It's something that they're living with and seeing every day. And we would love to have their perspectives and their experiences that they had during that event, and then the post follow-up. You could imagine the stress, whether you had children or not in the school system, whether you're going to stay in the area, how this is affecting your employment. And then we're also wanting to understand how this relates to their long-term health outcomes, particularly what's related to diseases like cancer.
And when it comes to, as I was reading through just basically the brief synopsis of this program, you used the term damaged DNA or damaged DNA. First time I've ever heard of this. In fact, not quite sure I knew that a person's DNA could get damaged. What do you mean by damaged DNA?
So what we mean by the damaged DNA is really a change from your germline genetics. So you received your germline genetics from mom and dad. And then as you go through time, there's what we call somatic events. And somatic events are changes in that DNA that either occur just naturally from, basically like if the eraser on your pencil starts to become debilitative, it won't work as well. Then you may have an error and is going to progress. Or you have your DNA repair system where that eraser can remove those damages and then repair that back to its normal. So we're looking at kind of measuring that. And as you get older, you can imagine that your DNA repair system just doesn't work as effectively as when you're a child, or when you've had high exposures to things like certain chemicals or lifestyle behaviors.
I think that makes sense. Damage to your DNA, and certainly your environment can impact how that happens. What do you expect to find? And I know this is probably very early on in this question. Do you expect that the people of East Palestine, now 6, 8, 10 months into this, do you expect that they've already had damage to their DNA?
We expect that people who've had direct exposure to those chemicals likely would have some measures or damage effects. So that's part of where we want to set this baseline, where we can measure it at this point and then follow them across time. We're going to compare it to some national databases to give a perspective of removing the background or the average based on your age. And then we've also had some other alternatives where we can look at samples that were collected previously. But the end goal is to give an idea of where they are currently, and then have a longitudinal follow-up to see how that is actually changing. Because the good news is your damaged DNA can be repaired. So it could be repaired naturally. So somebody who has an acute exposure to chemicals may have this high mutation rate, but then it could come back down to normal and be repaired. So we want to kind of get an assessment of that. So this will also measure chronic as well as acute exposure to chemicals.
I did not know that you could repair DNA. We're learning a lot here today. Let's talk about, use the word baseline. I'm assuming, and there's no way this could have happened, I'm assuming you would have liked to have seen DNA from these individuals, obviously before the crash, and then how that would compare to now. Being months and months into this, Is it too late to get a really reputable baseline, or how does that work?
It's definitely would have been great if we could have looked into the crystal ball and saw it happening beforehand and collected. But we are basing this on the epicenter. So we're expecting that people who had higher exposure that was closer to the event is going to have more of the damaged effect versus those who are further away. That's what we're trying to evaluate. The other component to your question, I think, is that there could be some chronic long-term exposures that are happening, and that this will kind of measure that as a baseline, and then in a follow-up sample a year or two from now to see if there's been a change.
And then let me jump off of that. Year or two, is this kind of thing that you need to follow these people for just 2 years, or do you need to follow the East Palestine residents for 5 years, 10 years, 15 years? What kind of a window are we looking at?
Yeah, it's partly with this measure, that's not a clear answer. So we think we're going to have multiple years here. My guess would be like a 2 to 10 year period is where we're going to want to follow up community members as much as possible to understand their risk. And this also is going to be based on your overall age and your health history. Individuals who are kind of more at the extremes might have a much more accelerated mutation rate versus someone who's been very healthy and very conscious of their environment and other things might come back to baseline much more quickly.
Let's talk about getting these volunteers. That's, I'm assuming, going to be one of your major hurdles. How many volunteers do you need, and how do you get them to be involved? How do you get them to say, I just want to be left alone, I don't want anybody here, I don't want anybody looking at my DNA? How are you going to get people involved?
The best way to get people involved is to show that this is for the long term, that we're not just coming in, taking their samples, going back to our research silos and doing our assays or our experiments, that we will return the results back to them. We will talk to them about what the results are, and to engage with the community to make sure that there's not things we're missing, that we're not asking appropriate questions. If we can add on additional areas to focus on, then we would like to do that. So a lot of it has been the community engagement. We've been attending regular meetings over the last couple of months that the Ohio EPA and other groups have given to the residents. And we just spent the last 4 days down at the Columbiana County Fair with a research booth where we were providing information to the communities and providing them with a link to our study to engage and sign up.
So I'm assuming that's the next part of this. Anybody that's an East Palestine resident, is there a mile radius that you're looking for? Who can be involved here?
No, we decided not to put any kind of mile radius around that. What we're looking at are the 4 counties in Ohio, Mahoning, and Columbiana. And then on the other side of the state, we're looking at Beaver and Lawrence County in Pennsylvania, thinking that that's the most likely area where the plume and other contaminants could have maybe dissipated to.
And you said you've been at the meetings, you were at the county fair. Are you getting a good reception? Are people signing up? Do they want to be a part of this?
Yeah, I mean, we've had several great conversations with people, very engaged. They want to understand what we're trying to do, what is the impact on them at the current time, and what is going to be that 5 or 10 year impact on them as well as their family. I mean, a lot of them were individuals who had children in schools. We would love to keep that increase that even more. And that's why we're going to also be at the Lawrence County Fair as well as the Canfield Fair at the end of the month.
Excellent. And if they happen to be watching this or have family members that live in East Palestine, how would you like them to get involved? How should they contact Case Western Reserve University and the Case Comprehensive Cancer Center?
Yes, so the best way is we have a link set up for the healthyfuturesresearch.com, and that will take you right to a screener that addresses whether you're eligible if you live in those 4 counties. And currently, we're only looking at individuals who are above the age of 18. And if you're an adult, then you would go through and answer several questionnaires. There's a $25 incentive, and then an opportunity to give biospecimens for our future biorepository to help measure some of these things like the somatic mutation rate.
Let's get away from the medical side and the research aspect side of this. Let me just ask you this. Let's say I'm a resident of East Palestine. Why should I want to do this?
It's your community. It's your health. Part of some of the unknowns and things that you don't know what's happening can be explained through some of these studies. And we want to provide you the opportunity whether you decide to or not to, at least give you the opportunity to decide if you want to enter and be part of that. So we're hoping that this is something that you think about, not just for your own, but for your community and also for your children.
Excellent. And the idea of being able to identify a potential health risk complication because your DNA is being altered would make me want to think I would want some of the experts, especially at something as incredible as Case Western Reserve University and the reputation that it has, that this would be something people would want to do for peace of mind. Dr. Schumacher, we always give the final word to our interview subjects here, to our guests. What do you want people to know? Why is this such an important step for Case Western and for the people of East Palestine?
Well, I think this is important because obviously the national media and others have seen what a train derailment like this can happen, especially when they're carrying chemicals. We want people to understand, though, that we're here to engage. We are here for them in the long run. This isn't just about us thinking about our own research. And we want to make sure that we're including the community's perspectives. And so if you have any questions or concerns, feel free to contact us. We'd be happy to answer those.
Excellent. Dr. Schumacher, thank you very much for your time. Thank you for the research being done there at Case Western, for not forgetting about the people of East Palestine. Their lives were interrupted by this, and it's clearly going to have an impact on them for the very long-term future. Dr. Schumacher, thank you for joining us.
Thank you.
All right, take care, sir. Again, this is just a new research project. If you would like to find that link, we have included it at cleveland19.com in this story. If you know people who live in those 4 counties, give them a heads up that this is, as you heard from the doctor, this is not just a research project. This is a chance to have their DNA monitored for the years to come to see if there's been damage to their DNA and if that could lead to illnesses such as cancer. If we have any other breaking news, we're going to bring it to you here on our digital properties. Otherwise, we are getting ready for our 3.5 hours of news that begins at 3 o'clock on Channel 19. Until then, I'm Dan DeRose with 19 News Now. Have a great afternoon.
19 News is everywhere. Download our CTV apps and follow us on social media at Cleveland 19 News.